Assalamu alaikum wa rahmatullah wa barakatuh. My name is Abdulmalik Almutairi. I am going to talk about the E. coli infection. This is the table of the content as you see. Introduction and definition. The E. coli infection, short for Escherichia coli infection, refer to the illness caused by the bacteria. The E. coli bacteria is a common that naturally inhabit in the intestine of the human and also the animal. While most of the strains of the E. coli are harmless and even beneficial. Type of the E. coli infection. The first one is enterotoxinic E. coli, ETEC. This type of the infection typically occur after consuming contaminated food or water, and also it's produce toxins that affect the small intestine, leading to the symptoms such as watery diarrhea and abdominal cramp and vomiting. The second one is enteropathogenic E. coli infection, EBEC. This E. coli infection is primarily associated with infantile diarrhea. EBEC produce protein that attach to the intestinal lining, leading to the damage and disruption of the normal absorption process. The third one is the enteroinvasive E. coli cell, E. coli bacteria. EIEC is a type of pathogenic bacteria. They use aldehyde protein to bind and enter the intestinal cell. They produce no toxin. They do not produce a toxin, but severely damage the intestinal wall through mechanical cell destruction. The fourth one is EHEC. EHEC infection are often associated with consuming undercooked ground beef and pasteurized dairy product. And the fifth is the enteroaggressive E. coli, EAEC, which form an aggressive biofilm on the intestinal lining, leading to the chronic inflammation and diarrhea. Next, the diagnosis of the E. coli infection typically involve in combination of the clinical evaluation, medical history assessment, and lab test. The most common of the used for diagnosis is medical history and physical examination. The healthcare provider will review your symptom, medical history, recent travel, and potential exposure to the contaminated food or the water. The physical examination may help identify the sign of the abdominal tenderness and dehydration. Second one is the stool test. The stool is lab test that involve analyzing of the sample of your stool to detect the presence of the E. coli bacteria. During the test, a small stool sample is collected and sent to the lab for analysis. They will identify and characterize the bacteria, which can help determine if for example, if it's a pathogenic strain of the E. coli. The third one is urine test, can identify the E. coli bacteria. E. coli bacteria live in the digestive tract, as you know, and are found in the poop. If the fecal matter make it away from your anus to your valve or the penis, the bacteria can enter your urethra and cause a urinary tract infection. The fourth is the PCR test, polymerase chain reaction. PCR test is a molecular technique used to detect the genetic material, for example, the DNA of the E. coli bacteria. This method can identify a specific strain of the E. coli, and it's also the faster and more sensitive than the other method, as I said. Hemorrhagic colitis. The clinical syndrome of it is characterized by the abdominal cramping and bloody diarrhea with a low-grade fever, while hemolytic uremic syndrome occur HUC occur when the blood vessel in your kidney become damaged because the E. coli infection and become inflamed. This damage can cause clot to form in the vessel. The clot clog the filtering system in the kidney, lead to the kidney failure. The prognosis of the E. coli infection can vary depending on several factors, including the specific strain of the E. coli. And to ensure the best possible prognosis, it's important to follow the treatment plan provided by healthcare professionals and maintain good hydration and practice proper hygiene. And second, treatment. The treatment for the E. coli infection primarily involving supportive care, as most cases resolve on their own without specific medical intervention. Fluid replacement, rehydration is crucial aspect of the treatment, especially in cases of diarrhea and vomiting can lead to the fluid and electrolyte imbalance. Symptom management, over-the-counter medications such as anti-diarrhea drugs and can help manage symptoms like it. And the third one is avoiding antibiotic. Antibiotic use can potentially disrupt the normal gut flora, which may increase the risk of the developing complication like HUC, as I said. Prevention of the E. coli infection, practice good hand hygiene, learn how to wash your hand with a soap and water before handling food, for example, and use hand sanitizer with at least 60% alcohol content. The second one is the content cook food thoroughly, cook meat, especially ground beef, protein intended to kill any potential. Third is avoid unpasteurized. Four, be mindful toward safety, avoid drinking river and lake water. 5, practice good personal hygiene. Complexity, use proper hand hygiene after using public restroom. And take home message, E. coli is a type of bacteria that can cause gastrointestinal illness, human, and the symptoms include diarrhea, which can bloating, abdominal pain, and sometimes the fever. E. coli infection is commonly transmitted through food or water, especially undercooked ground beef, for example, or raw vegetable and unpasteurized dairy product. If you have specific concern, question, prefer to ask a professional for personalized advice and care. Next. These are the references of our seminar, and thank you for listening.